Hello viewers, this is Ç0V Network TV, a place where you can get the latest information about Nigerian news and out the news in details. Federal government releases sharing formula for first batch of COVID-19 vaccine doses. See your state allocation. The National Primary Healthcare Development Agency, NPHCDA, has released the details of how the first batch of COVID-19 vaccine doses will be distributed across the states. And this was disclosed during a webinar organized by NHPCDA tagged sensitization meeting with media gatekeepers on COVID-19 vaccine introduction. Vâçç Ç0V, executive director of the NPHCDA, had said the country will receive 100,000 doses of the Pfizer/BioNTech vaccine at the end of January. Vâçç Program Manager, National Emergency Routine Immunization Coordination Center, NPHCDA, during his presentation at the webinar on Friday said the vaccines could be administered around the last week of January or early February. And according to Oposen, states with higher percentage of confirmed cases will be given additional doses. He also noted that frontline health workers will be prioritized, while other batches will be administered to the elderly and vulnerable persons with comorbidities based on the World Health Organization guidelines. We have other sources of vaccines that are non-mRNA like the COVAX vaccine. The country and other stakeholders are working towards how they can get additional vaccines from the other countries like Russia and United States. Oposen said, "We want to assure all Nigerians that the vaccine is safe and effective. The vaccine will be introduced in 4 phases, and this is due to the availability and quantity of the vaccine that will come in at any given time. When the vaccine arrives, in the plan there is going to be the prioritizations of persons to be given the vaccination so as to optimize the available resources and vaccines that will be received, and this will be based on global best practices. And the first priority, when the limited doses first coming towards the end of this month and early February, will be the frontline health workers like immigration, airports, police, and military on essential duties, those working in the lab and other medical practitioners. And those states with higher numbers of cases will be given additional doses. We have mapped out the health workers in each state and locations where these vaccines will be deployed as soon as we receive them. All the states in the country have cases and we need to get the vaccines to them all if we want to achieve herd immunity." According to the data shared by NPHCDA, Kano, Lagos State, Katsina, Kaduna State, Vâçç, and Oyo will receive more doses for health workers. The breakdown is as follows: Kano 3,557, Lagos 3,131, Katsina 2361, Kaduna 2,074, Vâçç 1,900, Oyo 1,848, Rivers State 1,766, Jigawa 1,712, Niger 1,558, Ogun State 1,473, Sokoto 1,463, Benue State 1,423, Borno State 1,416, Anambra State 1,373, Kebbi 1,361, Zamfara State 1,336, Rivers State 1,306, Imo State 1,267, Ondo State 1,228, and Akwa Ibom 1,161. Others are Adamawa 1,129, Edo State 1,104, Plateau State 1,089, Enugu State 1,088, Osun State 1,032, Kogi State 1,030, Cross River State 1,023, Abia State 955, Gombe State 908, Yobe State 842, Ekiti State 830, Taraba State 830, Kwara State 815, Ebonyi State 747, Bayelsa State 589, FCT 694, Nasarawa 661. He also stated that the federal government intended to administer the vaccine to at least 40% of Nigerians in 2021, another 30% in 2022. Wow. Federal government gives condition for releases of vaccines to states. Also speaking, Kaburu Daradara, Director Logistics and Health Commodity, said the federal government will not release the vaccine to states until facilities such as cold chains are in place. Daradara said the vaccine must be administered within 5 days of receipt for it to remain potent, and only the state that show commitment would receive the doses when available. She added that 100,000 doses will be administered to 50,000 people because each person has to take a second dose 21 days after the first dose. So guys, what do you think about this? What is your own take about the COVID-19 vaccine that has been administered? And according to what we heard now, it has been shared in each state, to know the number of doses that each state will be collecting. But the fact is that I'm still concerned about Nigerians taking those vaccines, because obviously I'm very sure that many Nigerians might not be able to take the vaccine. Let's hear people's opinion. Some people were saying that as for me and my family, will not take the vaccine. Let them keep it as they kept the palliatives. Hope the vaccines will go the way of the palliatives that was distributed during the COVID-19. They said because it is vaccine, you want to give it out freely. If it were to be money, would you have given it out like that? Did you give out palliatives the way it's supposed to be? Did you release grants to the citizens? And Nigerians are saying that it should be shared well and monitor how the state use it. Let it not be like palliatives, whereby they will be waiting for their birthday to share it. How come you include Kogi State in the sharing from formulas when we have no single case of COVID-19 in the state? We're just praying that they're going to distribute this vaccine equally, because definitely, I don't think it will be like palliatives that they did not distribute equally. This one is all about life and death. And definitely we know that federal government will obviously distribute this vaccine the way they are supposed to distribute it, because this COVID-19 issue is something that we are not supposed to joke with. People were saying that this vaccine is not trusted and tested, but if we must take it, it's the president and his family should be given first before any other persons. Then all the ministers and their families, senators and House of Rep members and their families then have to take it before any other people take it. So guys, what do you think about this? What is your own take? Kindly drop your comment in the comment section below. For those who subscribe, we want to say a very big thank you to you for subscribing. We'll say God bless you. And if you're yet to do so, kindly press the subscription button below. And also please don't forget to press the notification button so that whenever we upload news, of course, you will be the first person to watch our latest news anytime, any day. We appreciate you for always being there for us at all time. We'll say God bless you to you, and thank you so much for watching our videos every time. Stay safe at this crucial time. It is very important to you, hear me. Have a great day. Bye.